Friends of Cancer Patient is a UAE-based charitable organization. Friends of Cancer Patient, or as we lovingly like to call it, FOCP, has been established 21 years ago under the directive of Her Highness Sheikh Jawahir bin Mohammed Al Qasimi, wife of the ruler of Sharjah. Her Highness had a vision of an organization that serves UAE community that works on 3 pillars. We have used those 3 pillars and objective to create what FOCP is all about today. Our first pillar focuses on patient access, and we don't speak only about providing financial access for the patient, but also moral and psychological support. The second pillar is all about the community. We want a healthy community in the United Arab Emirates that is well educated about cancer, their risk factor, and most importantly, prevention and screening measures. We focus in our second pillar on early detectables, cancer, and also how to provide screening program for it. Our flagship campaign is Pink Caravan that focuses on both cervical and breast cancer, and we have actually acquired a state-of-the-art clinic that offers free access for screening to all UAE community. Our third pillar is advocacy. Although Friends of Cancer Patient is well known for patient access and community awareness, our first and second pillar across the United Arab Emirates, but advocacy took FOCP work globally. Through our numerous membership, regionally and globally, we have acquired lots of partners and we acquired lots of support from various partners, and we have been advocating cancer and cancer policy not just on a national level but on a global level as well. We enjoy knowledge sharing with different partners like the Gulf Federation for Cancer Control, UICC, Union International for Cancer Control, American Cancer Society, and UK Cancer Research, among a lot of other partners that we have globally. Of course, one of our new addition to Friends of Cancer Patient is what we lovingly called Amira Fund. It is in the memory of our late president who passed away very young, tragically, 4 years ago. The fund has enabled FOCP to expand our work beyond the UAE borders to go globally. We provide also patient access and capacity building for lower and middle income countries. Our motto in FOCP is "We are with you," and we are Friends of Cancer Patients.
Good afternoon, ladies and gentlemen. This is Jamila from FOCP. We are pleased to present today a health webinar on cervical cancer, symptoms and causes in collaboration with Zulekha Hospital. Dr. Nidha Iqbal, medical oncologist. Thank you for your support and time. Over to you.
Thank you so much for having me today and to discuss this important topic in oncology, that is cervical cancer. This is a highly preventable disease, and that's the reason we should know the symptoms and causes of disease so that we can take protective measures to prevent this cancer. Cervical cancer is the 4th most common cancer among women globally. Approximately 300,000 deaths are attributed to cervical cancer, with more than 85% occurring in undeveloped countries. Cervical cancer is characterized by the abnormal growth of cells in the cervix, mostly at the region of the uterus that joins the vagina. Coming to the risk factors of cervical cancer, nearly all cervical cancer cases are related to human papilloma virus. This virus is a group of common viruses that may spread from person to person during sexual contact. It can be vaginal, anal, or oral. This human papilloma virus infection is very common infection. About 85% of people get it at some point in their lifetime, and many won't recognize it because it usually lacks symptoms. Most of the infections, they're cleared on its own. The body's immunity, it clears the infection. However, sometimes the infection persists and eventually it leads to cancer. Out of more than 150 strains of human papilloma virus, there are some high-risk types which are strongly linked to cancer. These are generally human papilloma virus 16 and 18. There are other strains also which are not related to cancer, though generally cause genital warts, which is the most common presentation of human papilloma virus infection apart from being symptomatic. This human papilloma virus infection, apart from causing cervical cancer, it also causes anal cancer, penile cancers, and oral cancers. Apart from human papilloma virus, there are certain other risk factors like immune system deficiency. People who have lowered immune system, like people who are taking some sorts of medications like corticosteroids, people who underwent organ transplantation or who are undergoing treatment for other cancers, and people who have human immunodeficiency virus, that is HIV. These groups of population, they are at a higher risk of getting cervical cancer. Then herpes, women who have genital herpes, they have a higher risk of acquiring this cancer. Then smoking, smoking is associated with cervical cancer, as women who smoke are twice as likely to develop cervical cancer as compared to women who do not smoke. Socioeconomic factors, cervical cancer is more common in women who are having less accessibility to screening. So that's the reason this is more common in undeveloped countries, because generally the women, they don't have access to the screening programs, they don't go for screening. That's why the cancer is more prevalent in these countries and in these areas. Then oral contraceptives are also associated with cervical cancer, and exposure to diethyl stilbestrol during pregnancy. If a pregnant woman takes this drug, the risk of having cervical cancer, it increases in the female bonds. Now we know the causes of cervical cancer. The next important step is the symptoms. What are the most common symptoms of cervical cancer? So the most common symptom is an abnormal bleeding. The bleeding can take any form, like it can be abnormal vaginal bleeding apart from the normal menstruation. It can be bleeding after intercourse, which is called as postcoital bleeding, or it can take the form of excessive menstrual bleeding. The other most common symptom is pelvic pain. The pain may be intermittent or it can be constant and is typically worse during or after intercourse. Then there can be abnormal vaginal discharge. Some rare symptoms include back pain. The back pain generally occurs when the cervical cancer has pretty much advanced and it is involving the pelvic area. It is involving the walls of pelvis. So that leads to pelvic pain. Leg swelling is also a late symptom, because when the cervical cancer, it presses on the lymphatics, that leads to bilateral leg swelling. Then there can be bowel and bladder symptoms, like there can be constipation, there can be excessive urination or burning urination. That is only when the disease is advanced, invades the uterus and it invades the bladder and the rectum. What is important about cervical cancer? What we should know about cervical cancer? It's that it's a highly preventable disease. It's a preventable cancer because cervical cancer, it starts with a precancerous stage. There is a stage which is called as precancer, which occurs before developing cancer. It is called as precancerous stage. And there are ways we can stop this from developing and from progressing it to cancer. So the first way is to prevent the formation of precancers. That is called as primary prevention. And the other is secondary prevention, when the precancers are already there and we take measures to treat those precancers so that we prevent them to progress them to invasive cancers. That is called as secondary prevention. So how we can prevent precancers? How we can take measures for primary prevention. Now we know that the most common cause of cervical cancer is human papilloma virus infection. So there is a vaccine for human papilloma virus infection that is called as SHO. So everybody in that age group where HPV vaccination is recommended should get vaccinated. There are two vaccines. One is Cervarix and the other is Gardasil. They are available to protect against the types of HPV that cause the most cervical cancers. So the American Cancer Society recommends HPV vaccination of children between the ages of 9 and 12. Children and young adults aged 13 to 26 who have not been vaccinated or who haven't gotten all their doses should get the vaccine as soon as possible. The American Cancer Society does not recommend HPV vaccination for people who are older than 26 years. Now, the idea here is why the children should get vaccinated, because the idea behind the vaccination is we need to prevent the infection once the person catches the infection. So the idea is to treat kids before they resume their physical contact. So once the HPV is already, once the HPV infection is already there, the HPV vaccine cannot help in that infection. It can help only if the infection has not been contracted. So that's the reason we should vaccinate all kids in the age range of 9 and 12 preferably. But if somebody has not been vaccinated, then they can receive their vaccine between 13 to 26 years. After 26 years, it's not recommended because by that time, generally the physical contact is resumed, and once the infection is there, this vaccine cannot prevent that infection. So what is the most common HPV vaccine schedule and dosing? Now, between 9 to 14 years of age, generally there are two doses which are recommended. So the second dose should be given 6 to 12 months after the first dose. The minimum interval is 5 months between the first and the second dose. From 15 years to 26 years, there are 3 doses which are recommended. In 3 doses series, the second dose should be given 1 to 2 months after the first dose, and the third dose should be given 6 months after the first dose. There are certain important things to note, which I already discussed, like HPV vaccine, it does not provide complete protection against all cancer-causing types of HPV. So routine cervical cancer screening is still needed. So even if somebody received vaccine, that doesn't guarantee that it will give 100% protection against all the strains, because it targets only certain strains which are high risk. It doesn't target all the strains of HPV. So even if somebody receives vaccine, there is a chance that the cancer will still occur, but the chances are less. So that's why screening is still recommended even if the vaccine has been received. Now, the HPV vaccine, as I already discussed, it only works to prevent infection, not treat an infection that is already there. That is why, to be most effective, the HPV vaccines should be given before a person becomes exposed to HPV. Now, the second type of prevention is secondary prevention. Now that Now that primary prevention, we already know primary prevention is by HPV vaccination. Secondary prevention is we have to find and treat precancers, the stage before cancer, so that we can treat that stage so that it doesn't progress into cancers. That is called as screening. Screening is like doing certain tests to find those precancers. There are two types of tests which are available and recommended. These are Pap test, also called as Pap smear, and the human papilloma virus test. These both tests are done in the same way and at the same time. These are done by a health professional, which uses a specific tool to gently scrape or brush the cervix to remove the cells for testing. The result of the HPV test, along with Pap test results, it determines your risk of developing cervical cancer. There are certain screening recommendations for the general population, like under 21 years of age, screening is not recommended. Between 21 and 30 years of age, the Pap smear testing is recommended every 3 years. And now the latest recommendation is only HPV testing, which can be done every 5 years. Between 30 to 65 years of age, Pap testing is an option which can be done every 3 years, or there's an option of doing both Pap testing and HPV testing every 5 years. And the third option is only HPV testing every 5 years. After 65 years of age, no testing is recommended if the Pap smears and the HPV tests have been done before and they were all negative. Then a female at 65 years, she can stop doing further testing. The HPV testing, this is basically a DNA-based test, which is a preferred method nowadays, and it is generally done in the same way as Pap testing. So what do cervical cancer screening test results mean? So now that the screening has been done with Pap tests and HPV DNA testing, so how we are able to, interpret the results? Now, if we do the Pap test, the result can be normal, it can be unclear, or it can be abnormal. So in normal testing, we have to follow the routine screening recommendation. When the test comes as unclear, when we're not able to say whether it's positive or negative, then we should go for HPV DNA testing, and we need to know the specific HPV types which cause high risk, which are high risk for cervical cancer. But if the test comes as abnormal, then we need to do certain other tests to confirm whether the cancer is there or not. The other test is HPV test, which is resulted as negative or positive. If negative, then no need for doing further testing, and we can follow the routine screening recommendation like HPV testing every 5 years. But if this is positive, then we need to determine whether the specific HPV strains like 16 and 18 are present, which increase the risk of cancer. That is the next step. Now that the Pap smear test has come as abnormal, or HPV DNA has come as positive with those specific high-risk groups, then the further testing is required to rule out cervical cancer. And the further testing is done with the help of colposcopy. So it's a type of an endoscope which is inserted into the cervix, and we see the abnormal areas, and we take the biopsy from that area to confirm cervical cancer. Once the cervical cancer is confirmed, then we need to stage the disease, and the staging is generally done by X-rays, CT scans, MRI, and PET scans. Unfortunately, if the cervical cancer is diagnosed after staging, we have to treat the cancer. And the good news is there are good treatments for cervical cancer. If we are able to diagnose cervical cancer in early stages, then it's a highly curable disease. And there are various treatment options which are available for cervical cancer. The treatments include surgery, chemotherapy, targeted therapy, immunotherapy, and radiation therapy. So to summarize today's discussion, what is a take-home message? The thing is, cervical cancer is a highly preventable disease. Human papilloma virus infection, it causes most cases of cervical cancers. Abnormal vaginal bleeding is the most common symptom of cervical cancer. Cervical cancer can be prevented by HPV vaccination in children and early adulthood. Screening detects precancerous changes which can be treated effectively. When diagnosed, cervical cancer is one of the most successfully treatable forms of cancers as long as it is detected early and managed effectively. Thank you so much.
Thank you so much, Dr. Nidha, for the informative session. And inshallah, we will upload the session on YouTube. If there is any questions from the view directly to you, I would like to request all my viewers, please subscribe to our YouTube channel to stay tuned for our upcoming webinars. Thank you so much, Dr. Nidha. And if you would like to say a word before we end up the session.
Thank you so much. It's like I'm always pleased to give such discussions because we need to create awareness in the society about such type of cancers which are highly preventable and which can be treated, which are having high cure rate like breast cancer, cervical cancer. It's my pleasure to give a talk on these cancers, and I'll be always ready to help you in these talks in future as well. Thank you so much for having me today.
Thank you so much. And inshallah, we will be looking for the future collaboration with you, inshallah. Thank you.
So much.
And Zulekha Hospital is a great support and a great medical partner for us always. Thank you.
Thank you so much.
Have a nice day. Thank you.
Okay, you too. Bye.